Hi, everyone. Welcome to another episode of Orthopod. We have here a very important discussion about what's happening worldwide in orthopedic surgery, but specifically focusing on two nations, one Uganda and one the DRC, the Democratic Republic of Congo. I have with me today a colleague from Makerere University, Dr. Brad Petrosor, who has interacted much with our other two distinguished guests, Dr. Jean-Paul Wanzou from Uganda and Dr. Simplice Vuhaka, also from the Democratic Republic of Congo. Welcome, everybody.
Thank you.
Thank you. Thank you.
So let me just begin, if I could, with Dr. Petrosor. Brad, help me understand from your perspective as a surgeon in North America who has interacted collaboratively many times with surgeons in Africa. What do you feel right now is the challenge for international collaborations during COVID? And then I'd like to also get each of the other surgeons to give their impressions of what's happening locally.
Well, I mean, the challenges for some international work are obviously the fact that we can't travel anywhere. And so there's that aspect of it. And then so there's an issue of not being able to get to places and that sort of thing. But by the same token, you know, we have in the past been doing already pre-COVID, you know, conferences online and fracture conferences and things like that with residents and the group at Mulago Hospital. And so some of the things that we've been doing pre-COVID because of the distances and the travel are playing over obviously into this time. But from a physical point of view, you still get benefit from doing, you know, on the ground teaching and talking and discussing and just physically going to meetings and meeting people. You know what that's like, and we're not able to do that anymore right now.
Well, and I imagine that things have changed fairly dramatically as well in Africa. Let me just state, I think we're now just at about just mid 5 million patients around the world with COVID-19 infections. And I think we are certainly continuing to grow. We're growing by tens of thousands daily. Let me begin with you, Dr. Jean-Paul. What's the situation like right now for you at your institution, and broadly what's happening for you, and is your understanding what's happening in Africa?
Okay, thank you, Dr. Bondari and Dr. Petrosor. Yes, I am currently working in Uganda, Kampala, exactly. But I'm from the DRC, Democratic Republic of the Congo, where my heart is still, even if I'm working in Uganda. So currently, the number of cases is growing. At the beginning, the curve was a little bit flat. So actually, we are at 212 cases, 0 deaths up to now. And the situation was a little bit stabilized until we had now the issue coming from our neighbors, Tanzania and Kenya, whereby the trucks entering Uganda to supply cargo, actually most of the cases are coming with those drivers. So, and the number of cases is increasing. But up to now, according to the record of the Ministry of Health, we have 0 cases. Now, coming to our practice as orthopedic surgeon, really the number of cases has completely reduced because patients are locked at home. The number of trauma has reduced, and many of the clinic closed for a while, like our clinic closed for like about 2 weeks or so, but now we have reopened because we didn't have patients, and because of the lockdown, transport of the staff and so forth was difficult. So the clinic were closed, but now we have reopened and started working slowly by slowly. So this is the current situation on ground right now in Uganda.
If I can just quickly follow up with you, Jean-Paul. So is there currently a curfew? Is it a lockdown? Is it more of what we're calling physical distancing in Uganda? Or what is the severity of the measures that are being taken at a policy level in Uganda?
Okay, thanks. We are still in lockdown. Now we are in our 8th weeks of lockdown and going to another one. The curfew is still on since the beginning of the lockdown. Now we are approaching now 2 months under lockdown. Curfew is there. Those measures of social distancing, they are there officially, put on masks and so forth. Only some special services which are allowed to move and having special stickers like health professional and other services, banks and so forth to supply. So they were listed to actually to run the country, the minimum things. So only those ones are allowed to circulate. So it has made the number of trauma to reduce because the traffic, because Kampala is characterized by being a town with a lot of jam. Now there's no jam, the number of trauma has sensibly reduced. So basically that is the situation.
Is the situation in the Congo different, Simplice, or is it similar to what you're seeing or what's being told right now by Jean-Paul in Uganda?
Yes, the situation in Congo is almost likely the same as in Uganda. But Congo, as you know, Congo is a very huge country, the second largest country in Africa after Algeria. Before it was the third, before the Sudan gets divided. And as we are at the extreme east part of the country. So the country is divided into two poles, eastern pole and the western pole. And the specificity of Congo, I think it's the same in Uganda. All the cases were imported from outside to Congo. And as you know, Goma, where we are, it's bordered by Rwanda and Uganda. And most of the cases came from Tanzania via Uganda and via Rwanda, Kigali. And the total number in the country is around 225. And we are unlucky that 50 cases dead. And in the eastern, in Goma, we have only 15 cases with 0 deaths. And the management of the pandemics is the same as in Uganda. Officially, they say you must be locked in your home, and your distancing must be respected. You put on masks and so forth. But as you know, this is not well respected because people are living by the daily activities. So it's very difficult to get people staying in their home. The tendency is that people are just going in their usual work. The only difference is that the small businesses of inter borders has stopped, and so many families like ladies and women, vulnerable people who make a transaction trans borders is stopped. That's why we are getting somehow economical life here in Goma reduced very sensitively. And this has increased the situation which has been there of criminalities because people have become more and more poor. And each province organizes itself. Like in our province, North Kivu is separate to other provinces. So each province is organizing itself, and according to the pandemics, like Goma, North Kivu can't communicate with Ituri, can't communicate with South Kivu, and there is no communication between Kinshasa and the eastern part of Congo. But we are lucky that in our region, we don't have so many cases.
Both of you raised very interesting points. The first point that I think is really, really underappreciated, but it's been published recently in The Lancet, looking at modeling new cases. And what they're saying is the biggest challenge right now to containing new epicenters from developing has been transport, importation. And they say it takes 4 people to come in with COVID to create a new epicenter in a place. So, border management is very, very important. And both of you speak very strongly about the fact that cases have come in and they've been imported from elsewhere. I think the world needs to learn a lot about that particular issue, and that likely is going to be one of the big issues for international travel, if not travel, between borders within the continent itself. The other point, though, that I think I wonder about, and I'd like from your perspective, on the ground, you are taking significant measures in both those countries. To the outside world that is seeing, hundreds of thousands of cases, we're seeing now in Brazil, and many, many thousands of cases in Canada, and the US is the #1 with over 1 million cases. They look at 200 and say it's a success, it's done. There is no concern in Africa. Is that true? Do you feel that there's no concern, or are you concerned now that there's a possibility, if these measures are lessened, that you will start seeing an exponential increase in COVID-related cases and deaths? And I ask either Jean-Paul or Simplice, whatever you have a thought.
Okay, thank you. I will start. I think, on my point of view, the people or the government, they are concerned of the situation, which is a complex situation. However, in Africa, the challenge is the international measures provided by those big international organizations like WHO may with time be worse than the disease itself, because most of our population, they are people who are getting active income. That means they have to go out to earn something for their daily living. So locking them for weeks, it's really a big problem, very big problem. So that with time, people really disobey and they don't follow that, and they start moving out. Okay, walking, like here in Kampala, it is allowed. You can walk, you can use a bicycle, you can use a motorcycle, and you reach a point that sometimes you see people are outside, and a lot of them, because they find that instead of dying in our homes with hunger, we better go outside. And even they are seeing that there is no yet death in Uganda for COVID, so they are not really fearing the disease now these days. They say, instead of dying with it, with hunger inside, I better go outside, and even if I get it, I will get healed. So that is the complexity of the situation. Though here in Uganda, the president is still not following what the population wants, is still lock the population inside, but they go out. So that is the challenge. The cure itself might be worse than the disease. Well, that's what I can say.
Well, and I'd love to hear from you also, Simplice, but let me just make a point that I think resonates. We've just literally gotten off the phone chatting with colleagues in Pakistan and colleagues in Brazil. They echo exactly what you have just said, Jean-Paul, which is the poverty, the risk of going into even deeper poverty or deeper concern with poor is not sustainable. So people are saying we're going to go out and survive rather than die, and children are wasting, right? So we're seeing, an untold consequence to young children in impoverished nations where they don't have access to basic necessities because no one can provide. So I think you raise a critically important balance, and this is the balance I think that is so underappreciated, is that do the policies ultimately aim to help the world population? And maybe the policies that apply to other countries may not necessarily make sense for some countries. And I wonder, Simplice, if your experience in the Congo would echo that maybe there is more potential risk to physical distancing policies in populations that need to work, as Jean-Paul has said, and many others in nations are feeling the same stress.
As Jean-Paul has just said, is exactly the same situation in the DRC. whereby, as we said before, that the population live by the daily setting. So it's difficult to lock them down the house. That's why the strategy that our government took is just to isolate the cities where we have cases, not locking the population inside their homes. But they took some measures, you know, they closed churches, schools, universities, and where people can be in a big crowd. But as you know, our market are like churches, our market are like universities and schools. So the danger is still there. And the example of Goma, the city where I am, the local government has started even to open up the country to other provinces. But 1 week ago, we got immediately 7 cases at a go. That scared us. That's why the town is again isolated to others. So the danger is still there. So we don't know how we'll go with this situation. And I think the situation might be worse than in Brazil or other places in the world.
Brad, did you want to say something?
I'm just curious as to what do you think the numbers are so low? I know you're getting the numbers, but like you said, there's been very few deaths. There's been, is it the lockdown that's working, or why do you guys think the numbers are lower there right now this time?
Well, right now we can say the number is low, but it's tricky because we don't have the tests, rapid tests of COVID-19 to know how many people can be affected, because you know this pathogenic of this disease, you can transmit the disease when you don't have symptomatic signs. So yes, we have 15 cases so far. It's not big, but we don't know the number of people with this disease because there is no any test which has been done. So it's we can be happy, but we are not sure that if the 15 cases are the real number of people affected by these pandemics. And I think very early the government closed the border with Rwanda, with Uganda. That's why the number is not scaring. But I'm very sure that among the population we might have some cases if there is a very large spread of testing in the population.
And I think
so. It's not very sure.
I think that's the key issue, right? Is that you have to make the assumption, and I think both of you are showing a great degree of caution in saying everything's fine. I think the governments are showing a great degree of caution, because the reality is that you have a populous country, respective countries, that you don't know. And if in fact there is virus, it's going to spread very quickly and very rapidly. Do you have any lessons from history? Africa has been has just been tormented with infectious, spreads from historical data. Are there any lessons that the countries have seen before, and you say, this is what we have to be doing in this case, even though it's a different virus, this has the same feeling of what other, when we talk about other major infectious diseases like Ebola, but even prior to that, are there lessons you've learned as a country or as a nation that can be used now?
Like in Congo, it was like a transition between Ebola and COVID-19, whereby the last epidemics of COVID-19 came in when we were about to finish or to declare the end of Ebola epidemics. But what has been used as an experience, I remember there were some cases which affected Congo, cases which affected some Ugandan population. So what has been used, it was to close again the border. It was the same thing we are doing right now, whereby they identify someone, if he's in Uganda or in Congo, and isolate him in a center, a specific center for the treatment of Ebola. And it's the same that they are doing right now. And what they are doing in Congo is transforming Ebola treatment centers to COVID-19 centers. And they are using the same staff to do the same job after a training of these epidemics. So it's just the same, almost the same.
And are you doing anything differently, you guys, in terms of surgery? And if there's not as much testing as you like, are you like, what's the personal protective equipment supply like? Because I know for us even, my choice of mask is down to one potentially, So what do you guys do with that? Are you assuming everybody's positive, or did you change in that regard?
So as the orthopedic surgeon, we use supplies, and the supplies come from abroad. For example, when you use the sign implants come from America, whereby we give the report and they send the implants. Now we are locked. We are locked with this implant, and some cases like bipolar hemiarthroplasty that we take from Uganda. Now it's closed. It's very difficult to get them. And what we are doing now, because it's only 2 months, we are using what was in our store. But we don't know if it takes 6 months, what will happen. But yes, we are still feeling, we are starting to feel the importance of getting more implant, more materials to do well our surgery. So I think somewhere we are blocked because of this situation. So the practice is not easy.
What about you guys, Jean-Paul? Implants are an issue sometimes anyway in Kampala.
Okay. In Uganda, when it comes to PPE, first of all, we had a challenge. Even the team handling the COVID cases, there was really a challenge of getting PPEs. So when it comes to surgery, orthopedic surgery, the precautions are still the same before COVID. So we are using the same PPE we used before for all the normal surgeries. That is the thing. For the implants, because we are lucky here to have some big companies on the ground with their branches or offices, so the implants are still available locally, and we are still getting them, but we don't know for how long, because the other advantage is the president didn't lock the cargo, so companies which want to import some of the item, if they get supply from India, China, it can easily enter. The cargoes, planes or trucks, they're allowed to enter. So for that side, there is we still have something. Now, to come back to the question of Dr. Bandari about the lessons we get from that disease, there are many things we've learned. First of all, because of that lockdown, the country has learned to rely on the local experts in the matter. And they have really done a great job, because the president now is relying only on the local experts in the matter of handling the disease, and really is happy of the result he's getting. They have done a great job. So that is one. So we've learned that we have to rely on our local expertise, not only to call people outside. And also, it has boosted the capability of people to think on the local solutions when it comes to handle the disease. They are thinking of producing some drugs locally, producing some PPEs locally. And also, it has taught people that it is not only to go outside to seek for better health care, because with the lockdown, even those well-off people, those richest people, even I remember there is a case of the governor of Bank of Uganda. He had a heart problem and he had to rely on Uganda for his heart surgery. So, and he didn't have any choice despite the connection he had outside. So they had to handle his case locally. So now people are learning to develop locally the sector, so that they can rely, first of all, on the expertise on the ground. Thank you.
That's a
If I
great
can, oh yeah, it is absolutely. And when you look to the future, and it's hard because every time we ask this question, it's so uniquely different to everybody in their own local environments. But do you both have a sense of when things may return to normal based on what you think is happening or based on what you believe is the current risk for things getting worse? Many people right now in North America are suggesting that it's somewhere between 12 months to 18 months from now before we start seeing a new normal. We use that term a lot, the new normal. But what I take it as returning at least to previous ways of functioning, previous access to the operating room, and previous ability to manage the healthcare the way you used to pre-COVID. Maybe I'll start with you, Jean-Paul, and then we'll end with Simplice.
Okay, thank you. But now with time, there's no longer fear in the population of COVID-19. From my perspective, the way I'm seeing things, people now have started learning how to live with the disease. So if there is no interference of the government when it comes to maybe importation, things coming from outside, if they leave the lockdown, people will go back to the normal situation and will learn how to live with the disease the way they learned how to live with HIV and other diseases. Because the fear here locally is reducing slowly by slowly. And they are seeing that it is not really a complex disease because up to now, 0 death. Those who contracted the disease, they get cured. So there is a hope, but now people will learn how to live with the disease and continue with a normal life.
It's interesting. It's a normalized way of thinking of life. Simplice, do you have anything to add to that?
So right now, I think in Congo we have a way to go, because people, part of the population, they assume that there is no COVID-19. People here have been frustrated for long. The context of Eastern Congo, 3 decades of war, criminality is very high, and a big part of population think that it's again a trick of those who have their business in disorders and disease. Even Ebola, the understanding of Ebola even now is not yet really well understood by the big number of population. So for us, I think the first thing is to educate the population. And if this is not well done, we can get into troubles in our region, because they do not believe certainly in these epidemics. Those who are affected and they are witness of those who have been affected, they understand, because their relatives or friends have been declared COVID-19. But in our region here, we need first to educate the population. That's why they are really ready to go out despite the measures from the politics. So this is a very big challenge in our region, especially because we have not yet seen one dying of COVID-19 in our region. So they think that it's a joke, it's just a politics, it's just a business. So I think if the population do not understand it, it can be a big danger in the future. It's first educate well the population, convince them that the disease exists and they need to respect the measures. This is what I think in our region, in our places here, according to the context we are living in.
I think so much. Thank you both for those very thoughtful statements. I think what we're seeing also, just to give you a sense of Canada. So Canada has had some history with the SARS virus, and Canada was one of the places where there was an epicenter for SARS just less than a decade ago. However, we're now seeing very similar psychologies, right? What we're seeing now is younger individuals out saying, we're done with social distancing. We think that the risk of getting COVID is so rare that we're going to go out and start living. And we're starting to see big congregations happening of individuals. I do think there is a real big opportunity for all of us to learn from each other around education and reminding people that there is still risk. And I think we sometimes minimize that risk for very different reasons. I can totally understand that if my survival depends on me having to get out to make any sort of money so I can feed my family and feed myself and avoid dying from starvation and wasting, very different motive than people who feel, well, I just want to get out in the sun and enjoy the park. It's a very different psychological difference. But the truth is, in developed nations and in developing nations, people are still disregarding in large numbers the real reality of what COVID-19 is. Brad, I wonder from your perspective, looking at both you've been, where do you see your role as a colleague and friend to, to many individuals outside? And similarly, how can we learn from the messages that we've just heard from Simplice and Jean-Paul to apply to our own life? Because they've given us a lot of insight here that we should be doing in terms of Canadian policies.
Well, exactly, and you're right. Whether it be for survival or for fitness and general health, people want to get out. But I think the message definitely is, if you're going out for whatever reason, one needs to be exceedingly cognizant of how the virus spreads, what you can do about it in terms of hand washing, in terms of, in Canada now they're going to institute mask wearing. And that comes with its pros and cons, but but the proper education about the mask and proper distancing, I think, is where people really need to play their role. We know what the role of transmission is. We know how to wash your hands. We know what we can use to do it. So if one needs to go out, one needs to go out with some cognizance. And I think that's where some of it, even what we saw in Toronto over the weekend, like you're alluding to, where people were gathered and clearly not doing those things. And so I think that's the message. If you're going out, we understand that, but here's what you need to do when you do go out.
Yeah, and I do think that, and maybe I'll end on this point, when I've said this a few times, and I've reflected on this quite a bit, many low middle income countries around the world, many have been understanding the issue of access to care, have been understanding that getting health care is not a privilege, it should be a human right. This is probably the first time that we have seen around the world, all nations feeling in some small way what many countries have been feeling for their history and for decades, in that we absolutely have to do something. And maybe now we're seeing change because the world has finally woken up to the fact that we have to do something and we have to work together. These solutions are not going to come from one group or another. They're going to come from all of us collectively understanding that we have resources to share, and we have to help all of us get through this, not just the few of us who can afford it. Gentlemen, thank you both very much. Brad, thank you again for helping co-moderate today. I get the privilege of interacting with so many wonderful people. I can tell you, both of you just exemplify what is just exceptional about the field of orthopedics and about medicine. So Simplice and Jean-Paul, thank you both for your insight. Brad, once again, always nice to have you hosting and helping think through these very issues. Thank you so much.